Hello everyone. Now I'm talking about vital signs. Vital signs are the measurements of the body most basic function in four main vital signs. Routinely monitored by the medical professional and healthcare provider, including the following this. The one is the body temperature. Second is heart rate or pulse rate. Third is respiratory rate or rate of breathing, right? And fourth is the blood pressure. Or the blood pressure is not considered a vital sign, but is often measured along with the vital sign. Also, the vital signs are useful in the detecting or monitoring medical problem, right? The vital signs can be measured in a medical setting, at home, at the site of the medical emergency, or elsewhere. Okay. For now, we're talking about how to check your pulse. At the heart force blood through the artery, you can feel the breath by firmly pressing on the artery, which are located close to the surface of the skin at certain points of the body. The pulse can be found on the sides of the neck or the side of the elbow, at the wrist also. For the most people, it is easiest to check the pulse at the wrist. Okay, if you use lower neck, be sure you not press too hard and never press on the pulse or the both sides of the lower neck at the same time to prevent blocking blood flow to the brain when taking your pulse. Okay, the first step, using the first and the second fingertip press firmly but gently on the artery until you feel a pulse. Second, being counting the pulse when the clock seconds hand is on the 12th. Third, count your pulse for 60 minutes, or you can count 50 minutes and then multiply by 4 to calculate beat per minute rated. Fourth, when counting, do not watch the clocks continuously, but concentrate on the beat of the pulse. Fifth, is explained about if unsure about your results, ask another person to count for you. If your doctor has ordered you to check your own pulse and you are having difficulty finding it, consult your doctor or nurse for additional instruction. Thank you. Next, we're talking about the blood pressure. What is the blood pressure? The blood pressure is the force of the blood pushing against the artery walls during contraction and relaxation. Okay, of the heart. Each time the heart beats, is pumped blood into the artery, resulting in the highest blood pressure as the heart contracts. When the heart relaxes, the blood pressure will be fall. Okay. Two number are recorded when measure blood pressure. The higher number or the systolic pressure refer to the pressure inside the artery when the heart contracts and pump blood through the body. The lower number or diastolic pressure refer to the pressure inside the artery when the heart is at rest and is filling with blood. Both systolic and diastolic pressure are recorded as mmHg or millimeter of the mercury. This recording represents how high the mercury current in an old-fashioned manual blood pressure device, or called a mercury manometer or a fixed manometer, is raised by the pressure of the blood. Today, your doctor's office is more likely to use a simple deal for these measurements. Okay, so high blood pressure or hypertension directly increase the risk of the heart attacks, heart failure, and stroke. With high blood pressure, the artery may have an increased resistance against the blood flow of the, the blood flow. Okay, crushing the heart to pump harder to circulate the blood. The blood pressure is categorized as normal, elevated, or stage 1 or stage 2 or higher. Yeah, or high blood pressure. Normal blood pressure is the systolic of less than 120 and the asterisk should be 80, less than at 80 rated. So, elevated blood pressure is the systolic around 120 to 129 and the asterisk less than 80. Stage 1, high blood pressure, is the systolic is 130 to 139 on the asterisk between 80 to 89. Stage 2 blood pressure, a high blood pressure, is when the systolic is around 140 or higher, or the asterisk is around 90 or higher. This number should be used as guide only. A single pressure measurement that is higher than normal is not necessary. And in the case of the problem, your doctor will want to see multiple blood pressure measurements over several days or weeks before making a diagnosis of the blood pressure and starting treatments.